Hello, my name is Brett Kahr, and I am the Honorary Director of Research at the Freud Museum, London. It was, as you know, the home of Sigmund Freud in 1938 and 1939, when he escaped from Nazi-occupied Austria and then became the home of his daughter, the great founder of child psychoanalysis, Freud, from 1938 until her death in 1982. As you will all know, we've been living through a really, really rough time over these last several years with the ghastly outbreak of the coronavirus pandemic, the explosion of the war in Ukraine, all of the horrors of climate change and the economic recessions. And people have really, really been struggling, not only physically and economically, but as we know, from an emotional perspective as well. And as someone who works and has worked in this field as a mental health practitioner for over 40 years now, I can tell you that people have really, really been suffering. My colleagues and I have seen a huge spike in cases of severe depression, severe anxiety, a rise in suicidality. And that's the horrible, ugly news. But the really good news is we do have someone who can help us to get through this really, really difficult chapter of global history. And many of you will be familiar with this gentleman, our dear friend, the late Herr Professor Sigmund Freud, born in 1856 and died in 1939. And it really was Sigmund Freud who, more than anybody else in human history, made, in my estimation, an enormous contribution to human psychology, to mental health studies, to mental health treatment. Because back in the late 19th century, when Freud trained in Vienna as a physician, most of the doctors believed that mental illness, as it were, completely untreatable, that there were no successful remedies for people who suffered from schizophrenic psychoses or depressive psychoses or suicidality or anything of that nature. But Freud said, you know what? We can talk this through. 1896, he published in print in a French language neurological journal for the very first time the term psychoanalysis. He said, we can use what he came to call the talking cure, talking therapy. Sit down in a private, confidential, quiet room with a sympathetic, empathetic, compassionate, interested, detailed person, a psychoanalytical clinical practitioner who listens, helps you to try to understand. And through the creation of this process of psychoanalysis, my colleagues and I have now been practicing, we've been practicing as a community since the 1890s, for over 125 years now, over 1.25 centuries. And we have found through our own experience, but also through extensive empirical research, that Freudian psychotherapy, the talking therapy, really does work. It really can help guide people through this journey of mental horror. It can even cure many, many people and move people from states of real mental fragility to states of tremendous mental sturdiness. So Freud has done something really game-changing, really paradigm-shifting for the planet by introducing more fully, in a more detailed fashion than any other medical practitioner, any other healthcare practitioner, a real contribution to mental, in my estimation, that of many, many colleagues around the world. So I'm a big Freud fan, and I've had the privilege to be connected here to the Freud Museum, London, since it first opened nearly 40 years ago, believe it or not, in 1986, a very, very special opening ceremony we had where the cousin of Her late Majesty the Queen, Princess Alexandra, who's been a big champion her whole life of mental health charities and various clinical organizations, came and she participated in the opening ceremony back in 1986. And the museum has a terrific staff team, really protected Freud's house over these last 37 years, and we hope. Now, even though I and my colleagues here at the museum, we are all great admirers of Freud, and we've studied him very carefully, so we know what he has achieved. Freud has had to endure a very, very, very difficult relation with the general public over the whole of his lifetime and ever since. No two people have processed Freud in quite the same way. In my estimation, those of us who have really immersed ourselves in the study of Freud's biography and have read his writings carefully in English translation and in the original German, we're really deeply immersed in Freud, and we know that he was a good chap. We know that he was ethical. We know that his primary goal in life was to really devote himself very loyally to his patients. But because he was very brave and dared to talk about the impact of child abuse at a time when nobody ever talked about child abuse, the fact that he was very brave and dared to talk about sexuality in the late 19th century, early 20th century, at a time when nobody talked about sexuality. Many people regarded Freud then and still now with tremendous horror. Some people dismissed him as being literally a pornographer because he dared to talk to his patients openly about their sexual lives. He talked with them about histories of sexual abuse that they had endured at a point in history when the phrase child abuse simply did not exist. You'd really have to search very carefully to find the phrase child abuse, those two words clumped together, in print before the 1960s, when it entered the medical literature for the very first time. So Freud was a pioneer of childhood studies, child abuse and child trauma studies, and sexuality studies. And he really reversed the narrative of the old-fashioned 19th century approach to treating mental illness, which was essentially locking so-called lunatics away, so-called insane patients, into a lunatic asylum for life with no treatment. Many would literally be chained to their beds, chained to their walls, chained to the floors of these lunatic asylums. And Freud said, no, come and lie down on my couch. Be comfortable. Nobody will listen. This is a private conversation. Come and talk to me about your childhood, about your sexual fantasies, about your sexual experience. So he really humanized the approach to the treatment of mental illness. But a lot of people really hated him. He was dismissed as a pornographer. And nowadays, in the post-Black Lives Matter era and the post-feminist era, the Me Too era, and so forth, a lot of people have come to shame Freud as a misogynist old white man. And I have to say that that is not my understanding of Freud at all. I think were Freud alive today, had he not died in 1939, I think he would have been one of the first people to go out there and campaign for the Black Lives, or the Me Too. He was a real champion of women at a time when women were very, very marginalized and really restricted to household tasks. When Freud created in 1908 the organization known as the Wiener Psychoanalytische Vereinigung, the Vienna Psychoanalytical Society, the very first official professional psychoanalytical membership body. Membership was restricted in 1908, 1909 to males. And in 1910, Freud said, we need to bring women in. And many of his male colleagues said, no, 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 this is an all-male group. And Freud, as the founder, said, I'm sorry, we are bringing women in. And in 1910, a very pioneering female physician called Dr. Margareta Hilferding became the first official female psychoanalyst. And that membership, the introduction of women into the field, came entirely because of Freud's championship of women. And today, the profession is literally dominated by women. When I started training, it was maybe 50-50 male, female. And nowadays, people really struggle to find good male psychotherapists because so many women have come into the profession, thankfully. And I do think that Freud played an enormous role. So he was, in my estimation, a really feminist orientated analyst in that regard. And although many now dismiss him as an old elitist white man, I don't think Freud would have framed himself as a white man. He came from an Orthodox Jewish background at a time when Jews had only just begun to acquire citizenship within the Austrian Empire. And he was attacked anti-Semitically throughout his entire life, not only during the Hitler period, the Adolf Hitler period in the 1930s and beyond, but as a young boy, he was subject to anti-Semitic attacks. All of his relatives were subject to anti-Semitic attacks. So I think Freud would have identified himself much more as a minority figure than as an elitist white male. And also, although Freud, to the best of our knowledge, we don't have full detail of his sexual life and sexual history on a daily, nightly basis. To the best of our knowledge, the only person we know that he definitely engaged in sexual relationships with was his long-term spouse, Martha Bernays Freud, who bore him 6 lovely children, including the great Anna Freud, the founder of child psychoanalysis. So Freud would have identified himself as predominantly heterosexual, but he also questioned the notion of heterosexuality and homosexuality and dared to put forward the view that everybody has erotic and romantic attractions towards somebody called a mummy figure and somebody called a daddy figure. And you can be a heterosexual male and yet still have warm affection towards other males. You can be a heterosexual female and still have those affectionate feelings towards females, and so on and so on. Freud said that the notion of gender and sexual orientation is not as black and white as many people frame it. So I have to say, I see him not only as a great champion of humanizing the treatment of mental illness, using the talking therapies into psychiatry and psychology, and really changing that healthcare narrative very, very dramatically. But championing women, championing children, taking the narrative of children very, very seriously, encouraging females to come into the psychoanalytical movement, encouraging his daughter to provide mental health services for children, but also in questioning the notion of sexuality as a very, very rigid notion. I think with all of the discussion today about transgenderism, Freud would have found that very, very interesting and also very unsurprising. In many ways, early on, he dropped hints that human beings had that propensity. So in my opinion, having spent over 45 years reading Freud, probably on a daily basis, I have a tremendous love affair with this man. I would say that 99% of what I've learned I've had the privilege to study with many, many great psychoanalytic and psychological teachers over the decades, but I would say that 99% of the wisdom that I incorporate into my own consulting room on a daily basis has come from this man, Sigmund Freud. So I'm very happy to admit that I'm a fan. That for those who are skeptical about Freud, please do keep an open mind and go and read some of his writings, go and read some of the very, very serious, very scholarly biographies about Freud. And come to see the Freud Museum London at 20 Maresfield Gardens in London, Hampstead. NW3. It's a wonderful, wonderful institution, so beautiful. And I think when you come into Freud's home and see his beautiful collection of antiquities, see his lovely psychoanalytical couch covered in a Turkish carpet, see the beautiful furniture, his wonderful books, and the tremendous atmosphere that the staff team have created, you'll start to develop a love affair with Freud as well. He really still is a gift that keeps on giving. So much that we can continue to learn from him. So when people dismiss Freud as this misogynist, please regard that accusation with skepticism. Please take Freud seriously and come and join us. Thank you very much indeed.